For those of you who are new to my page, my name is Dr. Adam McBride, and I'm what is called a chiropractic kinesiologist, meaning that I use muscle testing to determine any kind of structural, biochemical, or even emotional dysfunction that's affecting the entire body. Every spinal segment contains a specific nerve that innervates not only a visceral organ in the body, but in turn also a muscle that correlates with that particular visceral organ as well. From this, we can determine certain types of issues that may be going on with the human body and getting a window into the nervous system functioning overall. We can also use these specific points on the head, which we term neurovascular reflexes, that were discovered by Terence Bennett back in the 1930s. Using the pulse points, which are used in meridian therapy as well as acupuncture medicine, we can determine what is the most deficient meridian in the body and then correlate that back to the specific muscle that in turn affects the certain organ as well as the certain spinal level. A specific case that I had with a woman today, 52, female, was complaining about right foot, right knee, back pain, and also had some constipation issues. What was interesting about this is that we actually traced the pulse point back to what is known as the wood element, which correlated back to her liver functioning. To give you an idea, the liver is located in the right upper quadrant of our body, and its main job is detoxification of the body, but it has over 500 different functions in terms of how it helps the body process its metabolism. It also has a direct correlation with the pectoralis major sternal division, which affects how the arm goes into horizontal adduction motion. The interesting part about this case study is that in particular, there was no major areas that we needed to adjust within the spine. However, we did find an emotion that correlated back to these points right up here, the Bennett's points or the neurovascular reflex points. For the liver in particular, about 1.5 inches above the eyebrow are what are called the frontal eminences, and it's just above that point right here is where the liver's neurovascular reflexes are found. The main emotion that she actually expressed was resentment, and this dealt with a subconscious aspect of how she had a friend who wouldn't be able to hang out with her, and she took this as feeling lonely, unloved, and she had felt like this since she was a child for her whole life. Now, the main treatment that comes to when you're actually finding these Bennett points is that you want to make sure that if you divide your body in half, you want to make sure that you can equalize the pulse point part so it can synchronize and have an equal amount of pulsating aspects from each side of the body when you're actually doing the treatment. So following just us holding these pulse points with just a slight tug on each side, waiting for the pulse to synchronize on her, we retested this muscle from the correlating pulse point that we found on her, turned on the muscle. There was no need for an adjustment, nor nutrition, nor anything else. What I always find interesting about meridians when I look at these in practice is it's more just a map of the human body, and you can either adjust that point, stimulate that point with either light, pressure, even some types of metals, and it can actually affect how the person can feel overall. Now, mind you, every case is different, but the most important part about any particular patient that ever comes in is their history. And one of the main things that this patient told me is that she's been having constipation over the course of the entire weekend, and that she had all these different pain point spots that had been affecting her. So once again, I hope you learned something, and if you have any questions, feel free to send me a DM.